Hi, today we're going to be doing trach care. I am checking my doctor's orders, checking my client care plan, I'm gathering my equipment, normal saline, sterile gloves, regular gloves, and a trach care kit. And I'm going to knot, and I'm going to gel in. Hi, my name is Sierra. I'm a student nurse from Fresno City College. Can you tell me your name and date of birth?
Cheyenne Garza, 0403-2000.
Okay, I am providing privacy. Hi, I am going to be providing trach care today. Are you having any trouble breathing? Are you coughing anything?
No, I feel fine.
Okay, so I'm going to start by doing a lung assessment. I am going to wipe my stethoscope with my alcohol prep pad. I'm going to throw that away. And I just need you to take a couple of deep breaths in and out your mouth. If this was a real patient, I would raise the bed up to a comfortable working height, lower the side rail, and elevate the head of the bed. Okay, here we go. Okay, can I have you lean forward now? Okay, and then lift your arm up on the side. Bend one more. Okay, everything sounds nice and clear. And then we are going to put our gloves on and open up our sterile kit. If we needed to wear more PPE because they were coughing or they had secretions or droplets and airborne, we would wear gloves, gown, mask, and eye gear, but here it's not indicated that we need to. So I'm going to open my sterile kit up. I'm going to remove my drape. I'm going to place it on my patient. And then I am going to put my gloves on. I am going to grab my normal saline, check the expiration date, check to see if it's been open. It hasn't, so I'm going to pour it in now. Okay. I am going to remove the old dressing. I wouldn't stand in front of the patient like this. I'd stand more off to the side, but there's no better position. I am checking the dressing for any drainage, the color, consistency. There's none on this one. I'm going to throw that in the trash, and then I'm going to hold the plate in place and pull the inner cannula up and out. I'm going to soak it in the normal saline now and discarded my gloves and put sterile gloves on now. Okay, I am going to grab an applicator now, and I'm going to wet it in the normal saline. I'm going to make sure my oxygen is at the bed right next to the patient if they need it during the procedure. I'm monitoring their O2 stat, and I'm going to clean from an inside circle, outside, all the way around. I am noticing the color, consistency, texture. If it's irritating or bothering the patient, it's not. And now I'm going to grab my inner cannula. I'm going to grab a brush to clean it. And I'm going to clean it just downward. And then I'm going to do it again to the other side. And then I'm going to do it one more time. I'm going to grab a windpipe cleaner. So getting clean normal saline water and go down the middle of the canister to clean it. Okay, I'm going to rinse my dressing off. I'm going to grab a dry 2x4 and pat dry the inner cannula. I'm going to throw that away. And now I'm going to hold the trach back in place and reinsert it. I'm going to grab another applicator, soak it, and clean again around the incision site, noticing more irritation if the patient had any, if it's bothersome anywhere else. I'm going to throw that away. I'm going to grab a new fenestrated dressing. I'm going to reinsert it. I would oxygenate the patient here if they needed it. I'd be looking at the O2 stat throughout the procedure to see how well they tolerated it. I'm going to remove the drape. And then I'm going to assess the ties of the trach to see if it needs to be changed, if there's soil, if there's irritation around the neck. There's not, but if there were, I would grab new trach ties. I would call for help if the patient is unable to hold the trach in place as we change them, because it could get dislodged if no one's reinforcing it as you're changing it. But in this case, it's not. So I am going to start to clean up my mess. I'm throwing my trash away. I am assessing my patient once again. Do you feel any trouble breathing? Anything irritating you around your trach area?
No, I feel fine.
No, so I'm gonna lower the patient, ask if they're in a comfortable position, and put up the bed rail. And then I am going to take my gloves off. My hands are a little sweaty, I'm sorry. Going to take my gloves off. I'm going to gel out. And then I would document how well the patient tolerated, if they had any secretions coming out, if I noticed any redness or tenderness, if they had any pain, their O2 stat, if they needed oxygen throughout the procedure, and then I'd make sure that there was a new trach in the room, bedside, ready to go in case it got dislodged. Thank you.